Hello, good afternoon. So it is the addictive doctor here again today. We are here to talk on, a major issue affecting the society today, and it's been a problem, yes, a challenge. But I'm here with a doctor friend of mine, Dr. Femi. So I and Dr. Femi will be trashing this major issue we call masturbation and bring it down to the female genital mutilation, right? So today we'll be doing a lot of justice to it. So as I introduce my friend, Dr. Femi, who is on stage today with me. So join me, share the video, like, comment, and share. Thank you. So Dr. Femi, over to you.
Yeah.
When we talk of masturbation, health-wise, what do you think masturbation does to the society? So tell us.
Yeah. This is a broad issue. So when we talk about health-wise, health is not just what people think. I'm fine physically. Health also extends it to the mental aspect, the social aspect. So it's a general well-being of a person.
Okay.
So, masturbation, of course, if you have watched the previous video, which I will encourage you to watch, you understand masturbation is, some people describe it as that of doing a solo sex with oneself, like stimulating pleasure by fondling with one's sexual organ. And has been discovered that some people, after each of these acts, they feel guilty about it. You know, when you feel guilty about it, some people can have a low mood, it can precipitate depression. So for people like that, their mental health is affected adversely. You know, some people, they're in a certain religious setting.
Yes.
They're told that masturbation is a sin.
Okay.
So each time they engage in it, they are aware that I'm doing something wrong. So their mental well-being is affected.
Yes, because they have guilt.
Yes, because they
Okay.
have guilt. Some of them, it might affect other areas of their lives. Their productivity becomes low rather. They have low self-esteem.
By productivity,
Yes.
I think if the person is a student, I think he's not going to be able to produce well academically.
Yes, exactly.
Is that the area you mean?
Yes.
But what if the person is a business person?
Yes, of course, it will affect the person's business as well.
How?
Because, business thrives on ideas and innovation. So someone who is guilty, someone who is so much overwhelmed with the issue of masturbation,
Okay.
such a person will not be able to make clear decisions that will move clear decisions. Let me use the word. Will not be able to come up with brilliant ideas that will help him to be more innovative.
But on the contrary,
Yes.
Dr. Femi,
Okay.
I have, in this work, I've met so many people, I've interacted with so many people.
Yes.
People send me messages, text messages, WhatsApp messages, and I've met somebody, quite a whole lot of people.
Okay.
If you're talking about advice, or people picking up ideas and innovations to thrive in business,
Okay.
I think I've heard some people say at the end of a certain an awful day, maybe what they were expecting did not turn out well, or they were embarrassed by their superiors at work,
Okay.
and they go back home and they can feel the turn on them that they had a bad day. So at the end, they find their kind of comfort in the area of masturbation. Is that the only comfort we can advise our society to get? What do you think about that?
Okay, yeah. Thank you very much for that question. Although, as a medical practitioner, most times we want to be tolerable in people's view and idea, in the sense that we don't want to be biased as per a religion, so that we will be able to meet people in different strata in society. And why I said that is that I don't want to speak with air of absolutism that, okay, masturbation comes with adverse effects. You know, some people, they tell us that masturbation helps to ease out the stress. So they want to put that as the advantage of such act. Well, some people might use it to ease out, to become comfortable, like to relieve themselves of the stress they've gone through at their workplace. But I want people to know that there are different approach to stress management, not just masturbation. Yes, you might need to speak with a therapist.
Okay.
You might need to speak with a therapist, and also in a setting where you have the human resource, the HR, you might need to speak to the HR, and they're not just to interview you and give you a call or a text that you have the job, or you have to send an email. They are meant to cater for your social need in workplace. So if there is a workplace bully, for instance, you might need to speak. Maybe there is a particular department in your place of work, for instance. Maybe there is a guardian, there is a guardians and counseling unit. You might need to meet them and tell them. And if there is a way that workplace bully can be reported,
yes,
if there's a way that workplace bully can be reported for in insane society and insane crimes, there are institutions like that. There are systems like that put in place. So for someone like that, you might need to leverage on those institutions, on those systems, and you probably might need to make an official report that you are being stressed because of workplace bullying. So, and I'm sure that your place of work, they will want to do something about it, because they know that they are not just providing services, they are also managing people, so as to increase their own productivity as well.
Okay.
So they will want to give it a chance by allowing one of their workers to be adversely affected, because of course, if a worker does not give a company a good image, they want to forestall that. So I think there are systems in place in most places of work, and one can be able to lodge complaints and be able to be well managed.
Well, I see that's a very good one, but I see how people naturally that have this kind of addiction as a challenge.
Yes.
It's kind of very difficult for them to just own up and just meet up people and say, hey, sir, this is my challenge. I'm actually a masturbator. What do you think about it? It's kind of very difficult for this age to just, come up to this committee setup to just say, I'm suffering from masturbation. I'm fondling with myself. You get it? So how do I, how is it presented? How can people just come out and say so?
Okay. Yes. There is stigma associated with it, of course. I talked about guilt the other time.
Yes.
And also, for instance, in a setting where it is viewed as a sin, it might be shameful for the person to come out and tell people that this is what I'm passing through.
This is what I'm engaged in,
Yes. And also, when I talked about meeting maybe a committee or a department, I'm talking about, I was referring to stress actually, not masturbation. Because, yeah, I believe that there are therapists, there are psychologists.
Yes, you're a therapist.
Yes, that help people manage guilt.
Okay.
Now, and for that kind of person, of course, you might want to speak to someone you trust. Yes, someone you believe that will not inform people out here that this is what this young man, this lady is doing. So you might want to speak to someone you trust, so that you're able to express yourself. Yes, you're able to express yourself. And for instance, I personally will encourage someone in it's someone in a religious setting, for instance. So maybe walk up to a pastor, maybe a counselor, a leader in your church or in your religious setting, who you know would handle it maturely. Yes. So of course, once they've earned your trust and you are able to walk up to them, I'm sure that you being able to open up and tell them. Of course, it will help you mentally.
Well, I think the medical word is different from the social word.
Exactly.
Because to the medical doctors,
Yes.
the secret of our clients is kind of confidential.
Yes.
So
yes.
I see people having it to be very difficult for them to open up to people because they feel unsafe,
Yeah.
and maybe period to time they've had experience of talking to people and hearing the same kind of discussion they had with such person outside.
Okay.
So I think such a person may not really buy to your idea.
Yes.
Maybe like, I tried it with Mr. Tamedu and it went haverside.
Yes.
Are you telling me to try it with Mr. Tajudeen? So how sure it won't have the same repercussion or the same replay?
Okay.
So what do you think? Is it better to see an addiction doctor or see, which step should the person take?
Yeah, thanks so much for that question. I really love that question, because I'm sure that most of our viewers, that question will have popped up in their minds when I
mentioned
it the other time. Yes, of course. No, I'm not only speaking as a medical doctor, but because I understand that you're a Christian. I watched the previous some of part of the video.
Yes.
You came from a Christian viewpoint as well. So being a Christian, that encouraged me to mention seeing a trusted pastor. Yes, but professionally, there are people that they are cognitive behavioral therapists. So, and I'm sure that they understand ethic, for instance. They understand confidentiality, that you are not to divulge the information of your client to people outside. And I believe that they are well trained. And for instance, as a doctor, if I have a client or a patient mention something and I become loose and careless, and I tell people out there, such a person can maybe seek a legal redress,
Yes.
and I'll face a disciplinary committee.
Yes.
So for professionals, they know that there is repercussion
For such.
yes, for such unethical attitude.
Beautiful.
Yeah, so they are aware. So they won't want to breach
Such contract or
yes,
such.
exactly. They don't want to go beyond their boundary.
Yeah.
So I believe that such a person should feel comfortable. You know, when you meet a professional, if you need cognitive behavioral therapist, a psychologist, yes, for instance.
Yeah.
So and they are professionals. They understand that they're not supposed to divulge information of their clients. So you should believe them, should trust them enough.
Yeah. So that's really wonderful, Dr. Femi. You know, I see masturbation to be a serious disorder, and I consider it a kind of disease of the brain.
Okay.
So, in that stage, I can also say one of the major reasons why men, especially married men, end up in masturbation is one, in female genital mutilation.
Okay.
So if I look at female genital mutilation now, all I can say about it is, it's either it is of the, or it's of two ways, right? It's either it's complete removal or partial removal, right?
Yeah.
So now, if you look at the complete removal,
Okay.
it means it's I see it to be, from experience chat.
Okay.
I can say complete female genital removal can, in fact, it's very painful
Okay.
in terms of sexual intercourse. It's really, 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 really painful, and it does not bring pleasure when making out. So, and the end result to every married couple is they want to really, really, have an enjoyable and pleasurable moment with one another.
Yeah.
So if it comes to a point where one of the spouse feels cheated just because, which is the male now, feels cheated because of process the lady has gone through, which is clitoris removal and all of that, I see that the man may want satisfaction, and if the man is kind of a man that is difficult to go against his vows,
Okay.
he might end up masturbating. And when such happens, well, personally, before I even ask you, my own advice is they should visit the appropriate quarters,
Okay.
because there are genital doctors that talk deeply about how you should engage in sex with a lady that has complete genital removal, mutilation you get, and a lady with a partial. I think when the lady, it's not I think, I know, when the lady actually has a partial genital mutilation, the lady actually still feels pleasure, because I have read and with time notice that lady tends to crave more for sexual things than the male, because the moment the male ejaculates, that ends it, right? He does not have the strength to go further. He wants to stop. But the lady, the moment she ejaculates, that is the moment she's starting. The more she ejaculates, the more she wants more, right? So I'm beginning to think that when the male, which is the male personality now, wants to engage in sexual activity with the wife now, and it's looking very, very painful to the wife, it's your wife. She's not a slut, right? You feel concerned. You feel constrained. You feel, empathy at that stage. So, at this point, it's kind of very difficult for the two of them to have a pleasurable moment again. So, I think one, if the man is not the type that will go out to satisfy his cravings, then he will end up masturbating himself. So in this kind of scenario, what can you really say about it?
Okay, yeah. Thanks so much. That was extensive. Yeah, so I'm sure I also learned some things from you. Yes. And I think I want to approach it from different angles. Yes, you mentioned that masturbation is a disease. Okay, although medically we may be biased.
Okay.
Yes, we may be biased. And also, of course, if I come from religious viewpoints, of course, I quite agree with you that one should not do that. Yeah, but for our viewers, some of them, they don't see anything wrong in it.
Okay.
Yes, for them, they don't see anything wrong in it. Yeah, but for people who see something, who they believe that masturbation is wrong, Yes. So engaging it, of course, would affect them adversely. Yeah, it will affect them adversely because they believe it is wrong, and they believe the society. When I mean by society, maybe the religious setting around them, they preach against it. So they can become guilty, they can feel bad about it, can affect them mentally. So for people like that, and of course, I'm going to that the issue of that female genital mutilation. Okay. For people like that, we need to actually trash it out well. Yeah, you mentioned female genital mutilation, although some people they might not see a direct link between female genital mutilation and masturbation. But like you rightly said, no, female genital mutilation, you are removing the external genitalia of the woman.
Yes.
In a case, maybe the clitoris, the clitoris helps to in stimulating sexual pleasure for a woman.
Causes arousal.
Arousal. And in some cases, they don't just remove the clitoris. Some people go as far as the labia minora. Labia minora is the one you see the female reproductive parts. You have the external genitalia is called the vulva, of course.
Yes.
The seeing is that's what you see directly. That's the labia majora. So when you part a female genital, sure. When you part it, you have the labia minora. Yeah, so close to the openings. You have the urethra up there, where the woman urinates, and have the vagina. Yeah. So when you remove the clitoris, in some cases when they go as far as remove the labia minora, and in another case, some people, some of those people that they do the female circumcision or the female genital mutilation, they reconstruct the labia minora and the labia majora. Once they reconstruct it, they do it in such a way that they can tighten the opening of the vagina. So it has its own complications, immediate complications like pain for the girl child, and there can be infection, there can be hemorrhage. From there, the person can be in shock and can die as a result. And we have the long-term complication. Yes, the long-term complication which you mentioned, it can affect their sexual health.
Yes.
Especially when it is the type that don't just remove the clitoris, but they also remove the labia minora and also the majora. When they do what we call the infibulation, they tighten the vagina. So for that kind of person, there's a higher chance that it affects them sexually. It might cause what we call dyspareunia. Dyspareunia means a painful sexual intercourse. The woman feels pain, and also it can affect. There's a need for vaginal wetness.
Yes.
Before the coitus or the sex, the penetration. So it might be painful for her, and it might be difficult for her to reach orgasm. I think you're trying to describe the orgasm the other time. Yeah, which we make her feel rewarded about the sex. Let me permit you to use the word feel rewarded. Yeah. So although like you mentioned, inside removing the clitoris, maybe she might still feel some pleasure. Although some people have
for the partial removal.
Yes, although some people also reported that even for the partial removal, it's a way of affecting them adversely as far as the sexual health. So for such a couple, when the husband is unable to satisfy the wife, so he feels, of course, he
feels agitated.
Yeah, he feels bad about it. So he might want to recourse to the act of masturbating. Well,
just for satisfaction.
Yes, of course, to get his own pleasure, of course. But what about the woman too? So, and the truth is that even despite all of these things, for instance, that's type 3. I didn't mention the type 1, you remove the clitoris. Yes. Type 2, labia minora, or with or without the labia majora. And I'm trying to look for something to simplify the labia majora and minora, so that my audience we really understand what I'm doing. But for married people, once you see the woman, the private part, once you see the labia majora, the two parts, how to open in between.
Yes.
So you know, the opening we have another skin which is more thinner. So that's in inside. That's labia minora. So I'm trying to for them to understand the anatomy so that they won't be lost. Now, for such a couple, yes, even though there are studies that have shown that some women have even undergone what we call a clitoral reconstruction, surgery. Because that would be most likely a multidisciplinary approach between the gynecologist and the plastic surgeon. Yes, so they do clitoris reconstruction, and it has been shown that there was an improvement in their sexual life as couple. Yes, for somebody in that type 3, you know, type 1, removing the clitoris, type 2, with the clitoris and labia majora and minora. The third type, when you do the infibulation, when they tighten the vaginal canal, it will cause, so it might cause what we call the gyneatresia, that is the tightening of the vaginal opening. So it might be difficult during sexual intercourse. Growing up for that young girl, she might even find it difficult to menstruate as well. So there's what we call defibrillation. So the surgeons, they know how to release those tightness. Okay. So and it has been shown that it's helped, that it improved the sexual life of the couple. Yes. And for the woman, it will help her to overcome difficulty in menstruation and all of that. So it has been shown that it's helpful. Yeah. So for such a couple like that, they might want to explore these routes I mentioned. Of course, when they come to an hospital where there is a gynecologist, of course the gynecologist would refer them appropriately. And if they can't do such a thing in those centers, if they can't do those corrective or constructive surgeries, yes, they might refer them to a place where they can do such, or where they will explain and everything. Maybe, of course, there's downside to it, the financial cost, because nothing comes free really. Yes. So for such a couple, they might want to go through that route. So they should not see it as the end of life. Okay. Yeah. They should not see it as the end of life. There is there are advances.
Because there are gynecologists that actually can put them in the right space.
Exactly. So okay, they shouldn't see it as the end of life. So the man should not just see it as I'm giving myself pleasure. Mm-hmm. So the woman too must be carried out.
Yes. So she must get to the level of orgasm.
Yes, exactly.
So I think if we are talking on this space now,
yes,
we are actually discouraging the female
genital mutilation.
Exactly.
Yes.
So we are trying to discourage the female genital mutilation, and because the adverse effect is one of the benefits is that while growing up as teenage, they don't get to easily get aroused.
Yes.
In fact, they don't even get aroused, let alone messing up. And I think that's one of the major reasons why parents went so far, yes, to do it to them, so that they won't mess up and bring bad image to the family by getting pregnant and thereabout. So I'm seeing it that anything good has bad sides too. The good effect is not as much as the bad. In fact, if female activists get to all the spirits, yes, I think they will have issues with them. Yes, so we are trying to discourage it with the addiction doctor that it is not what we should engage in, because the end result is always precocious, and it's not good. It's very bad. It's not advisable. So at this point, we want to round up this part 2. This is masturbation, part 2, episode 2, and we'll be coming up with episode 3 before we go to different areas. So Dr. Femi, it's really nice to have you on this space, and with this we have been able to really deal with addiction. The next one we'll be coming up with, a doctor will still come up, then a pastor will come up, and a man will come up just to trash so many things. Many people will come up, So please, your questions, you need help, whatsoever you need, whatsoever is bothering you on this subject matter, type it on the comment section or reach out to my DM personally. I'm always available to host and talk to you, young minds, old ones, because this virus we are talking about can take you years once you are an addict of it. So it can take you 15 years of your time because the senses of the brain get stereotyped to it and it's difficult to let you go. So please, see you next time. But don't forget to like, share, and comment. Thank you very much.
Yeah,
Dr. Femi.
Thanks so much.
Sir.
I really appreciate it.
Thank you, sir.
Thanks to our viewers.